Hey everybody, it's Dr. Dave, Psychiatry. Thanks for tuning the YouTube channel today. Today I'm going to talk about something, this is actually sort of a hard video to make. I had to sort of gear myself up for doing this. And the topic is really about post-traumatic stress disorder, PTSD. But the truth is, PTSD I don't consider to be, and this might be controversial in some sectors, I don't consider PTSD to be a chemical diagnosis. I consider it to be one of those emotional diagnoses that's important to talk about, but not necessarily give medication. So what am I talking about PTSD? PTSD stands for post-traumatic stress disorder. So post-traumatic, after trauma, stress, that is to say you had stress related to this trauma, and disorder. Disorder meaning you are not dealing with it as well as the average human should. Now, I'm not going to talk about the criteria for diagnosis. You can look that up in the University Internet. But the point is that people that have had traumatic events oftentimes have difficulty with anxiety, worry, sleeplessness, nightmares, what is called flashbacks, intrusive thoughts of things that have happened that really sort of people describe that they haunt them. And the treatment of the disorder, when it becomes chemical, really becomes, not necessarily the treatment of the event, not talking about the event. For me, if you're not dealing as well with the symptoms, well, then maybe your chemistry's wrong. So, in my opinion, that's not a traumatic related thing, that's a chemical related thing, which is why I don't really consider the diagnosis to be a chemical disorder that I treat. But for example, if you have terrible anxiety because of what's happened, and you're having panic attacks because of what happened to you, then certainly if I believe your GABA is low, which as you know from the channel would be the cause of panic attacks, if your GABA is here and should be here, then obviously I'm going to want to use tools like Xanax or Valium or Klonopin to raise your GABA, to help your GABA be more effective, to help you be more able to manage your anxiety about whatever trauma you've been exposed to. Similarly, if you feel very depressed about what's happened, very sad, hopeless, helpless, not caring about things, not functioning. And typically we wait until this has happened for some time chemically after a traumatic event. Oftentimes, you tell people you should probably wait, 2 or 3 months, sometimes even 6 months before you receive chemical treatment for something like that. But if someone comes to me and they've had a terrible event and they're clearly not coping with it as well as they should, then I have no problem trying a medicine to see if I can help them earlier. And the hypothesis for the sadness picture would be as if you're depressed, low interest, low energy, not caring about things, stop caring about things, then perhaps your serotonin or your norepinephrine is low. So again, chemically, we wouldn't treat the response to the trauma as much as we would treat the chemical disorder that might be causing more difficulties coping with the trauma. Same is true for overthinking. If you can't stop thinking about something, worrying about something, can't get it out of your mind, intrusive thoughts, if it's thinking too much, you've learned from the channel already, if it's thinking too much, it's likely related to too much dopamine. So too much dopamine can cause too much thinking and too much thinking about an event. If I can help somebody by dialing down their dopamine with a dopamine suppressor like Zyprexa or Trilofan or Abilify or Vraylar, then I will do that. Again, those are all treatments for the chemical side, not the post-traumatic stress disorder itself. One of the most important things that I think needs to be talked about, and this comes really from my experience with people that have been in traditional psychotherapy treatment for post-traumatic stress disorder, is that sometimes it's not a disorder if it's really very real to you. That when you have a terrible event happen, it's normal to have a reaction to it. And a traumatic stress reaction is different than disorder. So a disorder is going to have the symptoms that I described earlier that really underlying probably have a question of what is the chemical cause behind this. Well, I really wanted to talk about therapy a little bit because I recently had an experience, had a gal come in yesterday, and basically she had in her life the worst thing that any human can have, which was death of a child. And without identifying her, the death of a child was due to a drunk driving accident. And she had been encouraged to attend meetings that she could be around other people that have had this type of experience, so a trauma-related group. And she'd been doing this for some time. She came in this week and she said, honestly, Doc, I feel better because I stopped going to my meetings. And I said, well, tell me about that. She said, every time I went to a meeting, it felt like they pulled the Band-Aid off, just ripped the scab off. She didn't say Band-Aid, she said scab. Just ripped the scab off of that, and I just can't take it anymore. It doesn't help me to go once a week or whatever the time frame was. It doesn't help me to routinely go in and have the scab ripped off of that wound. I agreed with her 100%. And I supported the fact that she did not need to go to a meeting in order to feel better. In fact, in some ways, the meetings were probably making her worse. And I shared this analogy with her that sometimes therapy is, well, it depends on the therapist and the approach, but I don't believe oftentimes that the way to get to resolution of a problem is to dig deeper and dig deeper and dig deeper. And the model of the therapy that she was involved in was basically every week you'd go and you would, scratch at that and, disrupt it again to see if somehow that was helpful. Some therapists, they want to just dig and dig and dig and dig. I don't think that works as well. My opinion is when people need something, they need resolution. And the truth is we all have bad stuff. The truth is we all have traumatic things that we don't want to think about or remember. I have things as a doctor that normal humans should never see, have not seen, don't want to see, and stuff that I personally don't want to think about. Medically, obviously, we all have personal stuff too. We all have traumatic things that happen to us. Well, what's the goal of dealing with a traumatic thing? Really, it's to be able to not have to worry about it all day long, to not have it in your face all day long. So the goal of therapy, rather than, well, the idea is something like, if you have a book of life, well, that event that's in that book of life, that page is not going to be ripped out. So if I grab this book and say, okay, this is the traumatic event, well, the page doesn't get ripped out and thrown away. The traumatic event that's on that page is part of your book of life from now on. I have them. You have them. Everyone has something like this at some level. Maybe it's not as bad as others, but everyone has traumatic stuff. You don't do therapy to make those pages ripped out and put them in the shredder. It doesn't happen that way. The problem is when you have this, when the trauma is in your face like this, and it's in your face all day long. Well, that's terrible. So the first goal is to get the traumatic event that might be really troubling you out of your face and down onto the table. Now, the book is still open. The page is still there, and it's pretty fresh. I can look down on it right now. It's pretty fresh, but it's not in my face. So that's really the first step of therapy, is having it just not be overwhelming to you. Once it's less overwhelming and it's there, well, what's the next goal? The next goal is to be able to turn the page, to be able to look at the next page and focus on the next page and pay attention to the next thing, the thing that's not so bad. The goal is not to go back every week to read the bad page. And I think that's what this woman was experiencing, that every week it was as if she had tried to move on, and then she goes back and there it is again. It's on that page again, and she has to look at it. So goal number 2, really, beyond getting out of your face, is to get to the next page. So once we're at the next page and we're able to do that, well, then the next thing is to be able to close the book. Just to be able to close the book and really not be so concerned about the events in your life, to sort of just live your life and not have the book of concerns that's available to you all the time. That the book of concerns is not always something that you're concerned about. Well, what's the final step? The final step is to get it on the shelf. Put the book on the shelf. Once you put the book on the shelf, there it is. Now, as you can see from this video, the book is not gone. The book's still there. I don't have it in my face. I don't have it in front of me. I'm not flipping back to the previous page. It's there. That's where it is. But it's not something that I'm just paying attention to right now. Now, that's the goal, in my opinion, of good therapy for post-traumatic stress disorder. Get the daily worries and concerns and feelings about the traumatic event away from you so that they can be managed. Now, here's the truth. Has the trauma gone away? Do we ever talk enough, go to enough meetings, take enough medication perhaps, that the trauma goes away? Absolutely not. The trauma doesn't go away. The trauma's here. Trauma's in the book. It's right here. It's right there. There's that page right there. That's what it is. If you ask me about the stuff that's happened to me in my life, and if I get some reminder of something that I had to do in an emergency room or be involved with a patient that, had a tragic, terrible end or something like that, well, I can get that page right open right now. I can pull it off the page, pull the book down, open the book, and it brings me right there. I can remember and feel the same things that I felt decades ago, being in an emergency room when something tragic and horrible happened that we all had to deal with. But once I look at that, and once I have been reminded of it, and I have paid the attention to it that I had to have because somebody reminded me that I had to think about it, well, I can now put the page back on the shelf. Put the book back on the shelf, close the book and put it back there, and that's where it lives. Nothing about my life gets ripped out. My book of stuff is there and is going to remain there for the rest of my life. So for the gal that I was talking to today, I really encouraged her. I encouraged her that it's okay to not go back to that page once a week. It's okay to move forward. It's okay to get it off of your desk. It's okay to get it on the shelf to where you don't have to worry about it every day. She seemed relieved by that. She was actually somewhat embarrassed, I think, that she had to just admit that she just wasn't going to do the talk therapy anymore. And I could do anything more than just encourage her, to let her know that that was a very healthy thing for her to do. And it signified that she was actually better, maybe better than she thought she was. So the treatment of post-traumatic stress disorder is difficult, challenging, especially for the therapist. If you're a therapist out there, I hope that you encourage your patients to close the page and put the book on the shelf. For those of you who aren't having success with digging and digging and digging, I hope you pay attention to the fact that sometimes digging more doesn't help. Certainly a lot of therapists who disagree with me, and I'm not a therapist, so that's an important thing to say. But I know from experience in talking to people that, and personally, being able to get my stuff on the shelf and not away from my face is a good thing. As far as chemically, if you are suffering from the symptoms of depression, anxiety, overthinking, and relates to a trauma, well, then perhaps you need chemical treatment. You talk to your doctor about that. But I think it's important to realize that we don't give medicine to treat the trauma. There's nothing about medicine that treats a traumatic event. It simply supports, moves your brain chemistry so that you might be more able to deal with those traumatic events. So those are my thoughts on post-traumatic stress disorder, PTSD, for today. I hope it's helpful to you. I want to again remind you that if what you have is improved with medication, then you have a medical problem, not a mental problem. This isn't about being mental. This is about having medical issues that can be treated successfully with medical treatments, the medications that I use. And I hope that that's encouraging and helpful to you. I'm Dr. Dave, Psychiatry. Thanks for coming to see me today.